Stephen and Lindsay Averett always dreamed of becoming parents.
We both knew we wanted to have kids right from the get-go. I mean, it was important to both of us.
They got married, they bought a house in a good school district, and eventually started trying for a family. Lindsay was in her 20s and totally healthy. Yet, after nearly a year, they hadn't gotten pregnant.
It honestly didn't really cross my mind for, I would say, 11 of those 12 months that it would be a male issue. But finally, I said, well, maybe you should go to the doctor.
Urologist and reproductive specialist Dr. Michael Witt says male infertility is a more common problem than couples may realize.
One of the first things is figuring out how big a problem male infertility is. How big is it?
Well, it probably affects about 12% of men in general, though all couples who struggle with infertility, in half of those, there's probably a male contribution.
It can be caused by a myriad of factors: genetics, irregular chromosomes, obesity, drug use, even smoking. For some men, infertility is the result of something as simple as an undetected cluster of veins.
So when someone has a varicocele, a cluster of veins, how is that making a man infertile?
Yeah, it's just like a varicose vein you can get in your leg, except it's around the testicle. You can fix it, and it's just a simple occlusion technique. In about 80% of cases, you get improved production, and essentially you can enhance fertility rates, about 60–70%.
A lot of people probably don't know that, but if that's the problem, pretty high likelihood that it can be treated and restore fertility.
Like a varicocele, infertility caused by obesity, drug use, and smoking can also be reversed in many men. In even more complicated cases like Stephen Averett's, a diagnosis of male infertility is not necessarily the final word.
Sanjay is with us in New York. It's always nice to have you here. So what do you think, anybody watching his story, what should someone take away from that?
Well, I think, first of all, the cultural issues, if this couple, they were trying to get pregnant for about a year, and this is pretty common, but you typically think you got to get the woman sort of examined to figure out what is happening with fertility. But as you heard there, 50% of the time, it's on the male side, which I think a lot of people just simply didn't know that.
Yeah, I thought those stats were so high because it's really women who seem to talk about it much more.
That's right, and I think that they're probably the more the anxiety, because of that cultural phenomenon. But there's also things that can be done about it. In Stephen's case, he actually ended up getting diagnosed with testicular cancer, but they did a sperm extraction before he got chemotherapy, and then they subsequently did IVF, and now they're 33 weeks pregnant. So, the technology is remarkable. So that I was in this lab where, they're doing egg freezing now, something that people have talked about for a long time, but you needed to freeze, 150 eggs to get one viable egg. Now through these processes, like things called vitrification, which is like putting the egg essentially in a frozen type glass, 5 eggs and you can get a viable egg. So it's much more likely to be able to egg freeze, to sperm bank, to use surrogates, whatever it takes really in these fertility clinics to allow people to have babies.